Welcome to today's COVID-19 update. We're speaking with the Honorable Minister of Health, Dr. Frank Anthony. Minister Anthony, again, thank you so much for joining us.
Thank you very much for having me this morning.
All right, sir. I wanted to start off with our numbers. What is the latest figures that we have so far?
In terms of vaccination, as of yesterday, we've had 159,951 persons who have received their first dose of the COVID-19 vaccines. That would amount to 32.9% of our population 18 years and older. In terms of our second dose, we have 16,004 persons who have received their second dose, so they can be considered to be fully immunized. And that would be approximately 3.3% of our adult population 18 years, well, basically 18 years and above.
All right. Looking at the numbers and so on, have we seen any increase in the 18 to 39 age group? I know that was a concern last week for you.
We are seeing younger persons also coming out to get the vaccine. There are some slight changes in a positive direction, so we are happy about that. But we still need a lot more people to come out to get their vaccines, and so we want to encourage everyone to do so.
Right. I know word of mouth advertising goes a long way. And how has COVID Curve been going? We haven't talked about it, but I know they've been working.
The police and the army, they have been working. They have been in the communities talking to people, getting information out to persons. And also for those persons who violate the guidelines, quite a few persons have been taken before the courts. So they have been working. We want to do the softer side of things, trying to educate and so forth, but if there are people who are repeated violators, then they're leaving us with very little option but to prosecute them. And I think the police have been doing that in different places.
All right. I know we've also been collaborating with a lot of private entities. How have you gotten an uptake in response and so on?
We continue to work with a lot of the faith-based organizations, and they've been really good in working with our different regional teams to plan outreaches, to get to communities and to get to people that otherwise might be more difficult to reach. And we're very grateful for that type of partnership. We have also been working very closely with a number of community groups, and they too have been helping us to mobilize in different communities and have extended our reach. So we continue these partnerships, and we would like to see more of them happening. Especially in Region 10, because Region 10 still, when we look at our numbers, they're still lagging behind in terms of vaccinations. So that's one area that we want to encourage groups in Region 10, community-minded citizens, influential people who can talk to others to make sure that people take their vaccines. That is a very important part of the response. So we really want to appeal to those persons to assist us.
All right. Well, today is, of course, International Nurses Day. Just your general thoughts. We're in a pandemic, and they're basically our main frontline workers. So could we talk to you about that?
So, over the past year, I think the nurses have really worked very hard. They, as you have said, they're at the front line of this effort to prevent COVID-19 in Guyana and to reduce the burden of the disease. Initially, during the pandemic, they really put themselves at risk, and they continue to do so. But because we now have PPEs and available, that risk has been significantly reduced. But we are also introducing vaccines, and we have offered those vaccines to our healthcare workers in the first instance. And a lot of them have taken their vaccines, but there are still some others who have not taken their vaccines. And so today, as we celebrate International Nurses Day, I want to make a special appeal to all our nurses to make sure that they go out and get their vaccines for those who haven't done so as yet, and for those who have, to encourage others to get their vaccines. Because we know that these vaccines work, they're safe, they're effective, and one way of protecting themselves and protecting their families is to ensure that they get the vaccines. We want to also acknowledge the contributions they've made to patient care, to comforting families, because again, this sometimes this go unacknowledged, and it's tremendous work, takes a lot of personal toll sometimes. And so we want to thank them for all this work that they have done. Many of them have gone beyond the call of duty. We want to thank them tremendously for all that they've done, the sacrifices they've made, the contributions they've made. And I think because of their collective efforts that we have seen, the cases have been more or less where it is. And they continue to work to make sure that we get to herd immunity, and that's a very important thing. So I just want, on behalf of the Ministry of Health, on behalf of the government, on behalf of the people of our country, to express our gratitude to the efforts and contributions of all our nurses.
Thank you, sir. My next line of questioning, I read internationally that the CDC has acknowledged that the virus, COVID-19, of course, is an airborne threat now. Could you talk to us about that and basically how, aside from what we're already doing, what else can be done to protect oneself?
Well, the transmission, first of all, was thought to be done by droplets, which means the distance would have been within that 6 feet range. And then also it was postulated that transmission can occur by touching surfaces, hence the need for us to do hand washing after touching various surfaces. So these are two ways in which infectious diseases can be transmitted, especially those that from the nasal passage and things like that. But for a long time now, it has been postulated that this disease is also airborne in many ways. And that is because if an infected person sneezes, apart from droplets, there would also be aerosols. Aerosols are much smaller than droplets, and they contain viral particles. And if that happens in an indoor environment, those small particles can remain suspended in air for a longer period of time. So somebody can be infected, they have left the room, and those viral particles remain floating in the air in that room for more than an hour. And because of that, someone who can come into an empty room, they don't know what is circulating, what is the content of that air, and they probably don't have on a mask, and they can breathe that air, and they breathe in these viral particles. And if they do, then they can get infected. So there have been a long discussion pertaining to aerosols and its role in the current infection. And I think more and more the reputable international agencies that deals with epidemics have concluded that aerosols play a very significant role in transmission, especially in indoor environments. And so we too have to take the new evidence into consideration And we have to keep warning people that if you are working in an indoor environment, then it's necessary for you to keep your mask on all the time, because you don't know who you're interfacing with, and you don't know what is circulating in that indoor environment's air. So that's something that people would have to keep thinking about when they're in indoor environments. Outdoor, it's a little bit less of a risk, and that is because you have airflow. And so aerosols cannot remain suspended if you have continuous airflow. So in an outdoor environment, those aerosols would quickly be dispersed. So it's the indoor environments that we have to worry about when we think about aerosols.
All right. I know before this study was published, we had spoken about it a few times. All right. I have some Mythbusters. So the first one is vaccines are increasing the number of new variants of the COVID-19 virus, making vaccinated individuals more likely to infect others with new super strains.
Well, as you rightly said, that's a myth. Vaccines work by stimulating your immune system to produce an antibody. And so when you're attacked by the virus or you're exposed to the virus, your immune system would have already been primed to respond to the virus. So it has nothing to do with the virus mutation, the mutations that occur with the virus. Viruses on their own, because of their life cycle and how they replicate, as they replicate, during that process of replication, there are going to be errors. And those errors, a lot of them do not account for anything significant in terms of how dangerous they become. Many of those errors or mutations, as you call them, would just be benign. However, there are some of them, when they occur, they can actually change the infectiousness of the virus. They can change the way these viruses can infect persons and the severity of the disease. And the variations that we have seen, the variants that we have seen, it is because of the natural mutation of the virus and has nothing to do with vaccines. Before vaccines were available, we had mutations, and we are going to continue to have mutations because this is how viruses behave, and vaccines have no role to play in that.
All right, and the next one I have, the final one, COVID-19 vaccines have been proven to increase the risk of having a miscarriage.
Again, most of the obstetrics society globally, reputable obstetrics society, have actually advised pregnant women to take the vaccine because during pregnancy you are more at risk for COVID-19, and therefore they have urged women to take the vaccine because in all of the information that they've had and they've examined, they haven't seen any risk to the mother nor the unborn child. And so the benefits of getting the vaccine far outweigh the risk, if there's any, of taking the vaccine. So there haven't been any information, any studies that link vaccines to miscarriages. And unless we have that type of information, then this is very false and erroneous.
And if I can do just a quick follow-up, I'm not sure if you may have the numbers, but in terms of our own numbers and pregnant women, have we had any type of figures as to how many you would
We
have?
do have a number of persons who came in to the hospital, they're pregnant and they have COVID. I don't know how many of those persons have had the vaccine, if any of them. So we'll have to look at those numbers specifically. But again, if someone have any doubts pertaining to whether they should take the vaccine or not, they can consult with their physician, who can offer them the advice and would be able to give a one-on-one kind of advice based on the person's medical needs or the person's medical condition.
Okay. All right, Minister Anthony, as usual, thank you very much for speaking with us.
Thank you.
Well, that's it for today's COVID-19 update. Of course, we just spoke with the Honorable Minister of Health, Dr. Frank Anthony. Remember, for more information, you can log on to our website, dpi.gov.gy, and the Ministry of Health's website as well, health.gov.gy, and of course, our social media platforms.